Good evening, everyone. My name is Matt Jeffrey, and I work for MEDTRONIC. Tonight, I have the pleasure of hosting this webinar where we'll get to hear from Dr. Jonathan Corbett. Dr. Corbett attended the Ohio State University and his undergraduate study at Wright State University for medical school. He completed his internship and residency at the University of Cincinnati College of Medicine, and he's a member of the American Urological Association, American Association of Clinical Urologists, and American College of Surgeons. Tonight, Dr. Corbett will be speaking on overactive bladder and urinary retention, as well as a therapy called INTERSTIM. INTERSTIM therapy is an FDA-approved treatment for overactive bladder and urinary retention. As I mentioned, I work for MEDTRONIC, the company that developed this therapy. You might not be familiar with the name MEDTRONIC, but you do probably know somebody that has a pacemaker, and that's what MEDTRONIC is best known for. Before I pass the mic to Dr. Corbett, I do have a few reminders. Everyone has been muted upon entry. If you have questions, again, feel free to type those in the Q&A box located at the bottom of your screen. All names will remain anonymous. We will answer the questions following the presentation. Likewise, please answer the anonymous poll questions during the presentation and the anonymous survey at the end. And now allow me to welcome Dr. Corbett.
All right, well, thanks, Matt. Let's see. So like Matt said, I'm Dr. Jonathan Corbett. I'm one of the urologists from the Central Ohio Urology Group. I've been with the practice here in Columbus for about 18 months now. I focus mainly on kind of benign urology, kidney stones and BPH and large prostates, and then do a lot of voiding dysfunction and see a lot of patients with overactive bladder, urgency and frequency and surgeon confidence. And based on the poll results, it seems like a lot of patients here on the call this evening.
What are you doing now?
I just have to listen a little bit.
What is that? Where are those from?
Amanda, can you would you mind muting
Are
yourself?
those lobsters?
I just muted her.
That's Amanda, one of our fantastic physician assistants, and her son. So you'll have to forgive her. But as I was saying, a lot of the patients on the call here might resonate with a lot of these questions here, a lot of these statements. Wondering if you'll ever regain control of your bladder symptoms, or how could you go on a date, or go out to a party, or get a job, even leave home. We know that a good portion of our patients are embarrassed, to talk about those kinds of issues, and there's really no need to. It's just another bodily function, and it's a very common thing. It's something I talk about multiple times a day. So hopefully, this talk will help kind of change some of that stigma and at least encourage some of our patients to help get some more treatment for these kinds of issues. So tonight we'll talk about kind of how the bladder functions in a normal situation, and then how that can go wrong sometimes, and then what the multiple steps are in the ladder for treatment of overactive bladder, and we'll specifically talk about some of the MEDTRONIC options like the INTERSTIM and the NURO system, and then we'll have a question and answer session there at the end. So overactive bladder is an extremely common syndrome. It affects about 37 million adults in the United States. It's more common than eye problems and even more common than diabetes, but it doesn't quite get the discussion or the press that some of those other issues get. Overactive bladder is a quality of life issue and not always a quantity of life issue, but that doesn't mean it's not important to discuss with your providers, and that there aren't any things that we can do about it. Even if it's just a quality of life issue, that's affecting your sleep and confidence and self-esteem, and those are important things that we can help with. And the overactive bladder affects women and men of all ages. It is more common, a little bit more common in women and more common as we age, but can affect anybody at any point in their life. I talk to a lot of patients that tell me, oh yeah, I have those symptoms, but I just figured it was, a part of aging. Well, to some extent, that's partially true. It is more common as we age, but just because it's more common as we age doesn't necessarily mean that it's normal. And what things would we consider not normal? Well, going more than about 8 times a day, getting that have to go now or that sudden urge to go to the bathroom and have to run to get there. You know, patients having to plan their activities around the bathroom, or keeping a close eye on how much you drink, or even using pads if you're having some leakage with urination. And all those things are signs that, you know, the body, the brain, the bladder aren't quite functioning normally. So the normal bladder control is a complex interplay between the bladder, the nerves, and the spinal cord, and the brain. And as the bladder fills, those nerves, some of those nerves will start to fire and send signals up to the brain that the bladder is filling. And as it continues to fill, more and more of those nerves start to fire until that signal is loud enough that it kind of comes to the forefront of your consciousness. And then, you get that sensation like, oh, I have to go to the bathroom. And you go to the bathroom, and when you decide that it's time for you to start to urinate, your brain sends signals back down the spinal cord, first to relax the sphincter muscles, and then to contract the bladder and allow the bladder to empty. And that communication between the brain and the bladder is often the issue, and there are different ways that we can kind of change that to make it function a little bit more normally. So there are all kinds of things that can lead to bladder control problems, like daily habits, including what we eat and drink, can have a big impact on our bladder, especially our caffeine intake. Some medications or supplements that we take can affect these issues, and then things like pregnancy and childbirth and pelvic floor injuries, which are a little more rare, but all three of those things can also affect how our bladder functions. So in general, there are kind of 3 common issues with bladder control. One is stress incontinence. The second is urinary retention. And lastly, would be what we'll talk about would be overactive bladder. So stress incontinence is leaking with coughing or laughing or sneezing or exercising or straining, or standing up, sometimes going upstairs. It's more common in women, but can also happen in men who've had certain surgeries. It's typically due to a kind of weakening of the pelvic floor muscles and connective tissue in the pelvis there that makes it easier for that urine to leak out when there's increases in intra-abdominal pressure, which then presses on the bladder and can force some urine out. And this is, sometimes can be cured with Kegel exercises, but most often requires a surgery to fix. And that'd be for a different topic for a different night. Second would be urinary retention. And this is when the bladder, for one reason or another, just can't squeeze hard enough to empty completely. And oftentimes this results in patients needing to use a catheter to help empty their bladder. Generally, there are 2 forms of urinary retention, what we call obstructive retention and then non-obstructive retention. So obstructive retention is caused by a physical blockage that prevents the bladder from emptying all the way. Commonly in men, it's from an enlarged prostate. And then the second kind of category is what we call non-obstructive retention. So there's no physical blockage, but for one reason or another, the bladder just can't squeeze hard enough to empty completely. And then the third condition is what we call overactive bladder. And that's kind of a combination of symptoms like urgency and frequency. So frequency, like we talked about, would be going more than about 8 times a day. And urgency is getting that have to go now sensation, that sudden urge to go to the bathroom and having to run to get there. And there can also be urge incontinence associated with overactive bladder. So you get that sudden urge to go to the bathroom and have to run to get there, and you might start leaking a little bit before you get to the bathroom. And that can even cause some patients to start wearing pads to protect from that leakage. And this is the scenario most commonly where I hear from patients that, oh, I figured this was just a normal part of aging. And like we talked about already, it's not, it is more common as we age, but that doesn't necessarily mean that it's normal. And a lot of patients think, well, since it's just a normal part of aging, there's not really much we can do about it. And really, that's not true. There are multiple things that we can do to help kind of manage these symptoms for patients. So there are multiple steps in the ladder for treatment of overactive bladder, and those include lifestyle changes and oral medications, and then advanced therapies. And we'll talk about each one of these in a little bit more detail. So lifestyle changes are kind of simple things that pretty much any patient with overactive bladder should at least have tried or be doing still. The most common are dietary changes, and specifically decreasing your caffeine intake. Caffeine is a little bit of a diuretic, so it makes you produce a little bit more urine, and then it's also somewhat of a bladder irritant, so it'll irritate the bladder and cause some of that urgency and frequency. Getting a little bit more exercise can help with those symptoms. There are things like biofeedback or bladder retraining, which isn't quite as common, and then pelvic floor strengthening exercises, which can help with some of that leakage. The next step in the ladder would be oral medications, and these are typically taken once or twice a day, and they're relatively effective. They can cause some unpleasant side effects like dry mouth or blurry vision or constipation. Two of the medications can cause hypertension. And a good portion of our patients will stop taking the medications after about 6 months because of the side effects. There have even been some recent studies that have suggested that one of the categories of medications called anticholinergics can even increase the risk of dementia in elderly patients that are taking them. So all things to think about when we're prescribing these medications for our patients. And if the medications aren't effective, then kind of the last step in the ladder are the advanced therapies. And those would be kind of three things: sacral neuromodulation with the INTERSTIM system, posterior tibial nerve stimulation with the NURO system, and BOTOX injections. And each one of them has their kind of pluses and minuses, or risks and benefits that make them better for one patient than another, and we can choose which one might work best for you when we talk about these things in the office. So BOTOX is a medication that actually works to temporarily paralyze small portions of the bladder. So it's injected directly into the bladder through typically an office procedure. We put a small camera through the urethra and into the bladder and use a needle to inject the medication at several spots across the bladder muscle. And like I said, that results in a temporary kind of paralyzing of those small areas. It's relatively effective, works about as well as the oral medications, maybe a little bit better in some situations. There are some, side effects of the BOTOX. The two most common side effects would be urinary tract infections, mostly related to the procedure that we have to do to inject the BOTOX. And then there is about a 5% risk that BOTOX paralyzes too much of the bladder and patients aren't able to empty all the way. And that can result in urinary retention and could potentially require a catheterization for a short period of time, usually a month or so, until the medication wears off enough that the bladder can squeeze well enough again and empty again. And like I said, it is temporary. It lasts on average about 6 months. And patients often will come in for repeated injections. And since it is temporary, there are a good portion of patients that will stop doing the injections after a couple for one reason or another. The second advanced therapy option is what we call posterior tibial nerve stimulation. This is with the MEDTRONIC NURO system. So this is a in-office procedure. We place a small needle through the skin into the posterior tibial nerve, which is just above the inside of the ankle. And that we then deliver a small electrical current through that needle. That current runs up the posterior tibial nerve, up your leg and into your pelvis, and kind of intersects with nerves that run to the bladder. And that small electrical current can change the way those nerves function and change the way the bladder functions. And it can reduce that urgency and frequency and urge incontinence and restore the bladder function back closer to normal. It's, like I said, it's done in an office procedure. It takes about 30 minutes. We start with 12 sessions once a week. And then if it's effective after those first 12 weeks, then it can be continued in monthly maintenance sessions, which can potentially provide some long-term relief for patients. And the last advanced therapy option is what we call sacral neuromodulation with the INTERSTIM device. This gives a kind of a low level electrical signal, and it's more directly to those nerves that run to the bladder, and can kind of correct that communication between the brain and the bladder, or the brain and the bowel as well. There's a test period prior to implanting the full device to see if it will function for you or not. If it provides more than a 50% improvement in your symptoms during that test period, then the device is implanted. You have a small lead that runs through one of the natural holes in the sacrum, which is the bone at the base of your spine. And it runs along the nerves that go to the bladder and control how the bladder functions. And then that lead is connected to a small kind of battery, small device that's implanted just below the skin over the buttock. And now they have two options for that device. There's a recharge-free option and a rechargeable device. So you have a little bit more ability to pick which one would work best for you and your lifestyle. So like I mentioned, there is a test period. So this can be done either in the office or as an outpatient surgery. That lead, like I said, is placed through the skin and through the sacral foramen, one of those natural holes in the sacrum, runs along the nerves that go to the bladder. And then that lead is connected to an external device, a small, temporary battery pack that you kind of wear around your waist. And then you go about your usual activities for anywhere between 3 to 14 days. You have the programmer, which allows you to stop and start and adjust the therapy as you go. And like I said, if there's at least a 50% improvement, then we would go ahead and implant the full device. So it's all under the skin and you don't have to wear anything on the outside anymore. If there's not a 50% improvement, then we just remove the device. And just like anything, any procedure that we do, it has its own complications, which are typically smaller things like pain over the device, lead migration, technical issues with the device. And it can, just like any surgery we do, there's a risk of infection. So it is a safe and effective treatment option. We have about an 84% satisfaction rate among those patients who use it. There's about a 3 times greater improvement in quality of life when compared to medications. And about 75% of people have success with the INTERSTIM devices compared to about 50% with medications. And so who would be a good candidate for this treatment, the INTERSTIM? That would be our patients with significant overactive bladder symptoms, also patients that have the non-obstructive urinary retention, who've already tried lifestyle changes and oral medications, and who haven't gotten much benefit from those. So that's a pretty significant proportion of our patients, and it's a treatment that I often recommend and will offer, and I believe in it, and I think it helps a lot of our patients. So there are some frequently asked questions here. So for the INTERSTIM, the sacral neuromodulation is how long does it last? It kind of depends on the patient. It has been shown to have good success out to 5 years. If you use the non-rechargeable device, that battery typically lasts about 5 years or so, depends on the settings that you use. And then that battery can be replaced in a relatively quick outpatient surgical procedure. If you use the rechargeable device, that device can last for many years, much longer than the non-rechargeable device. And will it cure my condition? And well, it's not necessarily a cure. It doesn't necessarily, change that wiring that's gone bad, but it can provide relief and help with those symptoms. Most people would describe the sensation like a slight pulling or tingling sensation. And a lot of patients don't really notice it much at all. Will insurance cover it? And for most patients, the answer is yes. Medicare and many private insurance companies will cover the cost of the INTERSTIM. And importantly now, which is a recent change, is whether or not patients can have an MRI. And the answer to that question is yes. The new device, there's conditional approval for a full body MRI scan. There's a setting on the device that you can switch to make it MRI compatible, and if you have the device implanted, we show you how to use that. So that's a new improvement from the previous generations of the device. Let's see. There are some other questions for the NURO system that we don't necessarily have to go through. And then I guess we can open it up to some questions. I think there's a fair amount there. So there's a few of us at the Central Urology group that use the INTERSTIM device or implant and manage the INTERSTIM device. My colleagues, Dr. Cunningham, Dr. Osborne, Dr. Carey, and then myself as well. And we'd all be happy to discuss these issues with you in the office if you have any further questions. But I think, Matt, we can go ahead and start answering some of the questions that have been submitted tonight.
All right, thanks, Dr. Corbett. As you stated, we have a number of questions coming in. The first question we have here, it's a good question. Do you have to try any medications before moving to an advanced therapy?
Yes, so we typically go through each of those steps in kind of that pattern before we would get to the advanced therapy. So start with the lifestyle modifications and then move on to the medications. And if the medications don't work, then we move on to the more advanced therapies.
All right, next question. I also have occasional bowel leakage. Does the INTERSTIM therapy also help with that?
Yeah, so the INTERSTIM is also approved for fecal incontinence or bowel leakage. And so it can certainly help with those symptoms as well.
All right, next question. Are BOTOX injections painful?
So the BOTOX, the procedure, especially when we do it in the office, we give you some lidocaine jelly in the urethra and in the bladder and let that sit for a little while. The procedure is a little bit uncomfortable, and it kind of depends from patient to patient on how uncomfortable it is. But we certainly have patients that do multiple treatments, so not necessarily bad enough that they would stop doing it because of that.
And this is a kind of a two-part question. The second part of that is BOTOX. How does that compare to oral drugs?
So they're about as effective as the BOTOX and the oral drugs, the oral medications. I do see a little bit better effectiveness with the BOTOX in the right patient than the oral medications.
All right, next question. This is a question on PTNM. It says, how does PTNM compare to bladder stimulation, sacral neuromodulation?
Yeah, so About 60% or so of patients will have good results with the PTNM, and with the INTERSTIM, it's more like 75% to 80%. I certainly do see that the INTERSTIM is a little bit more effective than the NURO device or the PTNM.
Okay, the next question is, will we be able to access this recording? And that is yes. So that will be on your website. I'm not sure how quick it'll be up, but I know it will be on the website. Next question is, how big is the INTERSTIM device?
Yeah, so it depends on which device we choose. So if we use the non-rechargeable device, it's about the size of a $50, maybe a little bit thicker than that. The rechargeable device is about the size of a small flash drive, so it's a pretty thin, small device. And both of them are implanted under the skin, right at, kind of at the top of the buttock. And they typically, you won't see them. You might feel them if you sit on it, a little funny. But most patients don't, oftentimes they don't even remember where it is if it's been in for a few years.
Okay, you actually just answered the next question, was can you see the device under the skin? So let's move on to the next question is, what is the recovery like after I get an implant?
Yeah, so the recovery, depends a little bit on which test scenario you do. So if you do the kind of the in-office procedure, that's usually a shorter test, just a few days, 3 to 5 days, and really there's no very minimal recovery from that. If you then go on to the full implant, you have a few incisions on your back, and you might have a little pain for a day or two, but really, once the device is implanted, you don't have a whole lot of restrictions. Like I said, it might be a little sore for a couple of days, but patients usually bounce back pretty quickly from that procedure.
All right, thank you. Next question is, 5 years is all that it is effective?
So that is, 5 years is kind of the average battery life if you use the non-rechargeable device. If if the lead is in a good spot and we use it regularly and we follow up and are making sure we have you on the right program or make adjustments as we need, oftentimes patients have good effectiveness with it for much longer than 5 years.
Okay, great. So this is our last question that we have. Please, if you have further questions, go ahead and you can ask the questions there at the Q&A at the bottom of the screen. This is, what's the difference between the two testing options?
So the two testing options, what we call the peripheral nerve evaluation, or the PNE, it's kind of the office procedure, that we place 2 temporary leads, or at least try to put 2 temporary leads, one on each side, and then you wear that external battery pack. And that's more commonly used for patients that have kind of the overactive bladder type symptoms, the urgency and frequency. And that, sometimes it can be a little difficult. We do it in the office, and we, are using your bony landmarks to place the leads. If we do the kind of what we call a staged evaluation, which is in the OR, we actually place the permanent lead in using the x-rays and making sure that we have everything lined up in the right spot. And then we connect that permanent lead into the temporary battery pack. And then you go 2 weeks with the device in, and you take keep a close eye on your symptoms. And like I said, if you have a 50% improvement, we always have you scheduled for a second procedure at that 2-week mark. And if you have a 50% improvement or more, then we go ahead and implant the battery under the skin. If you don't have an improvement, then we take the lead and the temporary battery out. If patients have the non-obstructive urinary retention, I'm more commonly do that staged evaluation. I'll give you a little bit longer test. Or if patients had kind of so-so response with the the outpatient, the office placement, then we can do the stage response as well. We might be able to get the lead in a little better spot that way.
All right, thank you for that information. We do have another question that just came in. So aside from caffeine reduction, what other lifestyle changes do you suggest? Are there certain foods that need to be eliminated?
Yeah, so sometimes spicy foods can cause more irritated bladder symptoms and cause more of that urgency and frequency. And there are, random things like chocolate and other things that can affect some people. That's it. The most common irritant and most common thing that we run into is with the caffeine. But everybody's a little bit different.
All right, looks like we have a couple more coming in. Is there anything else that can be done if you've tried all of these options?
Well, in that case, we do have some patients that have kind of gone through all of the options individually, and we can potentially combine the options. So do INTERSTIM and have somebody on oral medications, or have the INTERSTIM in and do BOTOX or those kinds of things. But that's a relatively rare case, and not very common, but sometimes we do run into situations like that.
So this next question is in regards to urgency. It's basically a question: can they feel urgency if they're treated with this? I mean, can they get an urgency?
Yeah. So like we talked about, we would consider the device to be successful if you have at least a 50% improvement in your symptoms. So if you're having that sudden urge to go to the bathroom 4 times a day, and we get it down to 2 or 1 time a day, then we would consider that a success. So certainly there are patients that have basically a complete resolution of their symptoms. But I'd say the more common scenario is that we've significantly decreased the amount of times they have that urgency or frequency, and so you might still have some urgency, but the goal is to make it a much less frequent occurrence.
Thank you. The next question is, there are quite a few more coming in here. So exactly what does the device do?
Yeah, so the device provides a low-level electrical signal directly to one of the nerves that runs to the bladder. And we don't completely understand how that changes the way the bladder functions, but we know that it does. It changes the way those nerves function, and changes the way in turn that the bladder functions. And like I said, we don't know the exact mechanism, but we know that it works.
Thank you. The next question is physical exercise limited by any of these devices, i.e. swimming?
Yeah, so it would be temporarily while we do the test, and if you have those leads, there's the wire that kind of comes out through the skin. You wouldn't be able to swim during that. And then if we implant the device and we have those few incisions, while the incisions are healing, then we want you to avoid soaking in water. But once the incisions have healed and you don't have that that temporary wire anymore, then you're free to go about your daily activities, swimming or exercising, whatever you'd like.
Thank you. Dr. Corbett, is there anything else you'd like to add? If not, that concludes our questions. I will work, and we will work to get everyone's questions answered, especially if those questions were more specific to you individually. Some came across there, and we can reach out on a one-on-one or possibly go into the office to get those answered. Is there anything else you'd like to add?
I don't think so.
All right, well, thank you again for hosting the event tonight. It was extremely informative, and we're grateful for your time. I'd also like to thank everyone for joining us tonight. Please write down Dr. Corbett's phone number so you can contact his office to schedule an appointment. Also, please take time to fill out the short anonymous survey once this event concludes. You'll also see on your screen the survey appear, and if you don't fill it out now, it will be emailed to everyone. So this concludes tonight's presentation. Thanks for joining, and have a great night.
Thank you. Have a good night, everybody.
Thanks.